everybody. I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to introduce Dr. Bryce Casteigne. Dr. Casteigne, if I can pronounce his name exactly right, is a great young man from this area, really from the Thibodaux Gray area. Why don't you introduce yourself a little bit and talk a little bit about your interest and how you got into, how you became a doctor and some of those things, just so we kind of get to know,
I can do that.
know you better.
So, like you mentioned, from the area, grew up here, went to E.D. White, went to Nichols. Really got interested in medicine at a young age. I interacted a lot with some physicians that my family members had worked for, specifically Dr. Carolyn, who was a cardiologist here in town for a very, very long time. Her and her husband, Dr. Leo. My aunt,
Bear, right?
Yep. So my aunt worked for them for a long time. And I got to interact with them as a young child and always really admired the way they carried themselves, the way they treated patients. And so it really got me interested in doing medicine. And that interest just sort of flourished through learning a little bit more about biology, choosing to do biology at Nichols. And then I was lucky enough to get into medical school. And, here I sit.
It's amazing. Well, you went to LSU Medical School, which is a very good medical school. And then you went to Cincinnati, Ohio to do your residency. Why don't you talk about that for a minute?
Yeah, it was hands down my first choice of a place to train. Not just because it's an outstanding residency program, but because the culture there was so similar to what I was used to. It's a very collaborative environment, very congenial environment, very supportive of their physicians.
So in those 3 years, describe a little bit about the type of training and exposure to patients that you would get.
Sure. It varies. Typically, neurology residency is more inpatient focused. You take care of folks in the hospital more than you would in the clinic setting, but you do get a lot of exposure to different pathology in the clinic. We took care of just the complete array of neurologic cases, both inpatient and outpatient: stroke, epilepsy, movement disorders, autoimmune neurology disorders, neuromuscular disorders, dementia, Parkinson's. There's just this whole breadth we got to see. And thankfully, being such a large catchment area in Cincinnati, we had patients from the 3 or 4 surrounding states transferred to us on a regular basis. We got to see quite a bit. We got to see a lot of really complex cases that I think I can carry that experience here.
Yeah, I've been there. Of course, you helped arrange it and got to meet some of those leaders, and it's an impressive place. But then let's talk about fellowship. You went to Florida, the Mayo in Florida.
Yes.
Talk about that. That's a world-class type of training.
Yeah, I felt very, very lucky to match at the Mayo Clinic in Florida because they have the most up-to-date information, the most up-to-date technology. So I got to train on these advanced systems that not every hospital has access to. And knowing where medicine is going is a big part of even current care, to be able to anticipate the technology you may need in the future. And they really gave me the tools to do that. And then Mayo being the institution that it is, we had patients referred to us from other high-level academic centers for even further subspecialized care. Heck, I had patients come to me from out of the country, to come there. And again, like in Cincinnati, you get to see a lot of advanced pathology. You get to see just the more difficult cases. So I became much more comfortable with more difficult cases after having done that stroke year. And I will say, I think the biggest jump in my learning was that extra year of fellowship.
That's amazing. Well worth it.
Oh, it was more than worth the time I spent there. I enjoyed every minute of my year there.
We have these other neurologists, great young, well-trained neurologists. One of them has a stroke fellowship.
Yep.
One has epilepsy and so on. But in our area, this 5 to 7 parishes that we serve, 300 to 350,000 people, there's a lot of high blood pressure. There's a lot of strokes.
Absolutely.
It's some of the highest in the country, actually. So, again, we want to welcome you here to Thibodaux, back home. You got a wife and a kid, right?
I do. Yeah, I do. I have a 3-month-old. He's wonderful.
It's awesome. We went trout fishing one winter when you came down here, and I can say he knows what he's doing. He knows what he's doing.
I'm okay.
Thank y'all for joining us today.